All set? Yeah. Good afternoon. First, big congratulations to the Seattle Kraken, our new NHL team. I know many Washingtonians are looking forward to them taking the ice, and I'm certainly looking forward to this. And by the way, in celebration of this, I want to announce that the first Washingtonian who is under the age of 12 who can find a Kraken in the Salish Sea and verify that will get a free lifetime pass on Washington State ferries. We're going to keep our eyes out, and we look forward to the Kraken beating that team from Vancouver, British Columbia. We really look forward to that. Also, congratulations to the literally millions of Washingtonians who are masking up. We are so appreciative and proud of our state that we have engaged in a very committed, very unified approach of wearing masks. And that has been very, very successful across the state of Washington. And I just want to thank everyone for being willing to help in that way. We know it can help. We know it is helping. And we feel that our state is again leading the nation in this effort. Congratulations to Washingtonians. We do have some serious news today because our challenge is not complete just with our masking issue. Unfortunately, today our nation crossed the threshold of 4 million diagnosed cases of COVID-19. 1 million of those cases have emerged just in the last 15 days. Now that 4 million is just the people who have been confirmed to have this virus. We know that many, many, many more people actually are infected, and that's what makes this so insidious, because many people have the virus with no symptoms. It was 4 months ago today that we announced our Stay Home, Stay Healthy initiative. Now we're announcing some changes that have been necessitated by this pandemic to our Safe Start plan. I'm joined today by Secretary John Wiesman, Secretary of Health. He'll expand on some of my comments a little later and take questions. Just to give you a concept of the challenges we face, 4 months ago when we started this effort, COVID-19 had taken 110 lives of Washingtonians. Now, as of today, nearly 1,500 Washingtonians have died due to complications of COVID-19. And our hearts are with those families that are suffering. We know this is a most serious pandemic, and we are treating it as such. Today, with some of the advances that we are noting in this fight against the COVID. In March, more than 2,000 people had tested positive for the virus. We knew at that time this was likely just the tip of the iceberg, as I referenced. But as of today, more than 50,000 people in our state have tested positive for the disease since the emergency began. And more than 5,000 Washingtonians have had to be hospitalized. And we appreciate those heroes in our hospitals, those nurses and therapists and doctors who've gone into harm's way. And we appreciate today the work they continue to do. For those who have recovered, we also have to recognize an emerging scientific reality. And that is that people have long recoveries. They report respiratory and other medical conditions that may be chronic and certainly have given a long, long challenging tale to people's lives who have been infected. Now, we know it could have been much worse had we not taken this challenge head on, had we not followed science, had we not followed epidemiological advice. Had we not made some painful decisions early, we would not have bent the curve down, would not have led the nation, and many more people would have died. We took necessary, hard steps to limit activity and exposure to this virus. And every one of those steps was based on science and a commitment to each other to save lives. So our efforts worked as well as any state in the union's approach. And since then, we have worked wherever possible to turn the dial forward. We reopened many businesses, and we've spent the summer planning for safe ways to return to more of our activities. The reopening of in-person education is a goal I know that all of us share, but this starts with restraining the runaway growth of this pandemic. So we've had tremendous success in flattening the curve, but we knew when we began this reopening process, we would have to accept and make changes as the facts dictated. We would need to do what Washingtonians do. We knew we would have to follow science as it emerged. We knew we would have to accept and adapt to changing circumstances. And we knew that we would have to face our challenges rather than to hide from them. And today, that's what we're going to do. Now, I know we all care about business openings and people getting back to work. And I know that public health and economic activity actually go hand in hand. These actions we're taking today are certainly not an attempt to punish businesses. In fact, we've had enormous responsible actions taken by our business leadership. I was on a call with business leaders yesterday, just commenting on how we've had such high level of compliance with our decisions to date, and that's why we've had considerable success. But we do know this. At the moment, the only effective tool against this pandemic is to change some of our practices, and we need to do that. And unfortunately, we know this. The rate of transmission has been increasing around the state. Our suppression of this virus is not at the level it needs to be to continue to allow us to continue to allow more activity. If we let the virus get even more control, it will have even more devastating impact over the long term in our economy, and certainly in our health and the very lives of our loved ones. Now, this situation has been described by some of our experts as being sort of where Florida was several weeks ago. And as we know, Florida now has, many hospitals with no more ICU capacity. And we are in a position that possibly could result in a Florida-like condition if we do not act. So here's what we're going to do. We are going to take actions to reduce physical interactions in some of our businesses, with the hope that in combination with our masking initiative can get this pandemic under control. We know that fewer, shorter, and safer interactions are absolutely crucial in this fight. We know that staying home is the safest, but if you go out, we need to keep it quick, we need to have distance, and we need to wear face coverings. So today I'm announcing additional changes to our phased approach with the hope of limiting activities where the risk of exposure to COVID-19 could be the highest. These prohibitions are a part of our approach, but they only supplement what we really need, which is for individuals to make individual decisions in their individual lives that jointly can protect our community. So today's changes will affect restaurants, bars, fitness centers, as well as weddings and funerals. It will also affect family entertainment centers, movie theaters, and card rooms. Now, we do not take these steps I'll address lightly. We know every prohibition is a challenge to a business and challenge to individuals. But we know that we do not have an option here. If we fail to act, we will expose thousands of more people to this pandemic's ravages. So if I can go through with these now. Our changes to health requirements for weddings and funerals apply both to secular and to religious services. Ceremonies are permitted. Receptions will not be prohibited. For all phases, the maximum occupancy of these events is 20% or up to 30 people, whichever is less, and accommodating for physical distancing will have to be required. For restaurants and bars, indoor dining will be limited to members of the same household at the same table. Put simply, if you're looking for a seat with people you don't share a home with, you'll need to sit outside. If you're there with people who are in your household, you'll be allowed to sit indoors with the people in that household. Now, we're taking this step because we believe it reduces the potential for exposure and transmission in dining facilities, and we know these indoor facilities are the most problematic. This will also allow us to enjoy restaurants with our household members. And that's we believe, a very realistic, if somewhat nuanced way to reduce the transmission that could go on in restaurants. Our restaurants will also need to close vending games like pool tables, darts, and video games. And in phase 3, the counties that are in phase 3, table size will be reduced to 5 and occupancy to 50% of capacity indoors. We'll need alcohol service in restaurants to end at 10 p.m. and all bars will be closed for indoor service. We're also making some actions regarding activities involving fitness. In phase 2, only 5 individuals, not including staff, will be allowed for indoor fitness services at a time. This includes gyms and indoor pools, ice rinks, indoor volleyball courts, and indoor tennis facilities. A fitness center occupancy for phase 3 will be reduced to 25%. In addition to these changes, we'll make some changes involving what you might think of as not miscellaneous, but some other non-restaurant focuses. There will be a prohibition on indoor family entertainment and recreation centers like mini golf, bowling alleys, and arcades. These are indoor facilities. There will be a prohibition on indoor card rooms, and indoor movie theater occupancy will be limited to 25% in phase 3. Now with that, I'd like to turn it over to Secretary Wiesman to discuss the expansion of our masking order as well. John.
Thank you, Governor Inslee. The rising case counts, hospitalizations, and deaths due to COVID-19 in Washington state are a direct result of our collective behaviors, as you've suggested. What I do, what you do, what we all do in our lives makes a difference. Some of those things make the situation worse and others make it better. We must, as you said, prevent runaway growth of COVID-19 in our state with fewer, shorter, and safer interactions as being crucial. One way we're promoting safer interactions is by using face coverings. Wearing face coverings and limiting our interactions with others makes a huge difference. And Yakima is proving that to all of us. Their local health district is reporting that 95% of people are wearing face coverings in public. And now they have seen a sharp decline in their new cases. This is really, really great news for them and for the state. That is why today I am expanding my statewide face covering order requiring the use of face coverings by the general public in any common spaces, not just those in publicly accessible places. This means places like elevators, hallways, and shared spaces in apartment and condominium buildings, university housing, hotels and motels, and in congregate settings such as nursing homes, assisted living facilities, and adult family homes. This is an expansion of my previous order, which talked about wearing face coverings in public buildings and in outdoors when you couldn't maintain 6 feet of distance. And this additional order will go into effect starting this Saturday. We are now over 6 months into Washington's response to COVID-19. I know that many of us are tired and wish we could go back to the way we lived before the pandemic. That is simply not the situation we are in right now. We're losing the momentum we had during the early months of the response. Looking ahead to the fall in hopes of school reopening, we must dig back in to regain control. It's worth repeating that fewer, shorter, and safer interactions are crucial. Staying home is still the safest, but if you go out, keep it quick, keep your distance from others, and wear your face coverings. We all need to take this responsibility seriously, as I know we are, and as we've said, so many people are in the state. We're very appreciative of that. And we need to limit our activity to protect the health and safety of our communities, our families, and those we love. And back to you, Governor.
Thank you, John. I'm hopeful that this additional guidance is going to even make our masking initiative even more successful. And I'm really pleased that we are having early success on this initiative. Again, I want to thank everybody. But that means we need to sort of wear these in more places to make it more effective. Now, because we know that the COVID transmission rules will further delay full reopening of our economy. We know that there's economic hardship from this. This is really hard on people. It's hard on small business people. It's hard on people who are going to be out of work because of this. So we need to do some more to support these families. So we are extending our statewide eviction moratorium through October 15th. And we'll have more details about the specifics of that order, but I wanted folks to know that that will be extended. This extension will also direct my staff to convene an informal working group of landlords and tenants to discuss potential changes to the order in the short and long term if an additional extension were to be needed. In particular, I'd like this group to look at the potential for rent increases, which this moratorium has also prevented. So my staff's going to reach out to stakeholders and get folks' advice in this regard. There are certain exceptions to the extension. We expect landlords and tenants to remain in communication. If you haven't spoke to each other in March, when we first amount this moratorium, it's imperative that people communicate. This is meant to protect renters from falling into homelessness if they're struggling. So if you can pay rent, obviously, we need you to pay rent. This is for the folks who are really in tough times. This proclamation does not allow landlords to harass or intimidate tenants, and it allows for ways to constructively collaborate on securing payments. Criminal behavior and other threats to public health and safety are still cause for evictions, of course. I do want to note that we have taken some other measures to help folks in this situation. My office, through the Department of Commerce, has released $100 million in CARES Act funding. This is for low-income renters, and plans are currently in the works for that distribution. This will complement $300 million in CARES funds I released to local governments to pay for a broad array of immediate services, which could include additional rent assistance to localities should they decide to go that route. The federal government also released approximately $120 million to HUD funding, which can be used for shelter operations and rental assistance. So we hope that these are going to be helpful to families. These decisions are not easy, but they have been guided by science, and they have been guided by a belief that our destiny is in our hands. We can reduce the spread of this pandemic. We've demonstrated that, and we can do that again. And these measures, I have high confidence, will bring us success. And we certainly need that right now. So with that, I'd like to stand here for your questions.
First question comes from Joe with the Seattle Times.
Yeah, Governor, can you hear me?
Yes.
A two-part question for you. How is the state going to guarantee that the $100 million going through Commerce will be distributed to tenants in time for them to pay rent and avoid evictions? Certainly acting in context, partly because of the unemployment benefit delays with Employment Security Department. And second question is, other news outlets are reporting that the Trump administration has sent a Customs and Border Patrol tactical unit to Seattle, similar to what they've done in Portland. I'm curious if you're aware of that and if you've had any communications on that.
Yes, I have not seen any reason that we cannot distribute these in a timely fashion. The criteria for benefits would be dramatically different from unemployment compensation. As you know, there's a whole host of things that have to be demonstrated for people to qualify for unemployment compensation. Those requirements do not apply for this assistance, so I think we'll have hopefully minimal difficulty distributing these funds. If that changes, I certainly will let folks know. So I'm glad we're going to be able to help. Look, these people are in real tough times, and there's thousands of people in tough times. So I'm glad we're going to be able to render this assistance. The best information I give you is I had my staff called directly to the Department of Homeland Security, and were advised as recently as about 15 minutes ago that there are not security forces deployed to the Seattle region. The Homeland Security told my staff that this morning, and 15 minutes ago confirmed that. I also spoke to Mayor Durkin about this about 45 minutes ago. She told me she had spoken to Acting Director Wolf in the last few hours, and he assured her that there have not been surge officers sent to Seattle. and that before that would happen, he would be in communication with the mayor's office. So that's the best, most credible information that I have, and I think this is important because these decisions need to be made by local officials, and we don't want to see some of the activity that happened in Portland happen here, where there were great concerns raised about forces that were not identified picking up citizens without really following necessary protocols. So that's the best information I have.
Joe, would you like to ask a follow-up?
Yeah, Governor, when do the new restrictions on businesses take effect?
John, do you want to talk about the specifics? There are some distinguishing dates in there.
So the effects on businesses will start a week from now on July 30th. The restrictions on weddings and funerals will take place a week after that on August 6th. And then my masking order takes place on this Saturday.
Next question comes from Essex O'Carroll.
Yes, hello, Governor. Two questions for you. On the issue of dealing with evictions and rent, of course, one of the problems that people have is that so many thousands have yet to receive their unemployment checks. What more is being done to resolve those issues so people will have the money to contribute to rent? And then on the question of security, did either of the federal executives or departments assure you or Mayor Durkin that they would not send forces here without your concurrence?
No, but they did. What Mayor Durkin told me is that they told her that they would not do that without speaking to her first. We have asked for that ourselves from the Homeland Security. We've not received that particular assurance except in a vague fashion. The federal government needs not to inflame this situation. We all want to have peace, and we want peaceful protests, which are legitimate and important in this moment. But we don't want to see things that would make the thing worse and throw gasoline on a fire. So we expect that the federal government will be cooperative with the democratically elected officials of this state so that we can maintain and reduce violence and maintain the peace. And we hope that that will be the case. But as of the moment, we have had now 3 assurances that they have not sent forces to Seattle since this morning. Your question about unemployment insurance, everything humanly possible that could be done is being done to get unemployment insurance to people. I can tell you that. And the department, as you know, was hit with a tsunami of 10 times the number of claims that have ever happened before. They were overwhelmed, and we have now hired hundreds of people. We have brought in new technology, and the department has reduced the backlog from about 80,000 people in what's called the adjudication queue. These are people who have to have their cases reviewed in detail, and the employer has things to say about that to determine whether or not the claim is valid. This is not just an automatic thing. You have to show certain criteria to qualify for unemployment insurance. That sometimes is a laborious process. It involves multiple phone calls and multiple documents. But the department has reduced people in that queue from over 80,000 to about 22,000 as of this morning. And they believe they are on track to solve those by the end of this month. So we are very hopeful that that happens because people who have been waiting are in extreme distress. They are extremely frustrated, and I share that frustration. So we have bent every single human ability to follow the law, which doesn't allow the department just to send checks to everybody who asks for it. They have to look at the data to determine whether or not there is actually a right to those funds. Now, about 9 or 10 times those number of people have had their claims paid. And I don't have the exact billions of dollars, but it's a pretty impressive figure of the amount that has been paid out. There was an additional tens of thousand people whose identification was unfortunately in question because of the criminal acts of a criminal syndicate. And I'm very appreciative. I'm happy to tell you that we brought in the National Guard, and they have helped clear that background. So the National Guard has now fulfilled their mission to clear those ID people in that queue. So I can just tell you everything humanly possible has been done. People are working as hard as possible because these folks need help.
Essex, would you like to ask a follow-up?
Thank you.
Next question comes from Jim with the spokesman review.
Governor, in Spokane, where they say the masking initiative is working well and maybe 95% of the people are wearing them in stores and businesses, but they're afraid the spread is coming in backyard gatherings, barbecues, things like that, where people aren't masking and gathering. Is there anything the state can do about that? Because if that is a main cause of the spread?
Well, yes, we can do something. First off, we have a rule. It is the law of the state of Washington about gathering sizes, which we've addressed in the last week or two. This is the law of the state of Washington. It is also the law of the state of Washington to wear masks. So those things are the law right now. That's what we can do. Now, this depends on its success on the individual commitment of individual citizens and their families. We are not going to bring in the helicopter troops to parachute into people's backyards. We can't do that, and we shouldn't do that. What we should do is ask Washingtonians to be part of this joint effort to not infect people who are your friends and your loved ones. And we know you don't want to do that. Nobody wants to do that. The more Washingtonians understand that every single person you meet could be a carrier, and you can be a carrier yourself and not know it, the less meetings you're going to have indoors on a birthday party where you can infect a dozen people, or a barbecue where you sit too close together without masks, or, dare I say it, even a beer drinking party with some of our young people, which is some of the most troublesome aspects, because we have traced quite a number of clusters now to social gatherings, particularly of our brilliant, folks who we know have brilliant futures, but they're endangering themselves by having these social gatherings. So what we can do is everything we can do, and we're doing everything we can do, but it depends on people to step up to the plate. It depends on parents to talk to their teenage kids about this and be a little insistent. I'm giving the governor's privilege to give an order directly to your teenage kids, and maybe even your 25-year-old. Because even if they're immortal, and they're not, because an increasing number of our hospitalizations are people of that age group, and that's gone from 22% of our infections to 45%, they are not immortal from this disease. But just as, and maybe more importantly, if you're 25 and you've been invited to go out to a friend's house where you know there's going to be 20 of your buddies there, and you're going to hang for a few hours, there's probably nothing more fun in life to do that. I get that. But there's probably nothing more dangerous right now. And if more young people will accept this sort of responsibility, fewer of their parents will die because they won't get infected, and they won't go home and infect their dad, and they won't infect their grandmother. That's what this is about. And all I can do is ask at this point. Technically, it is a crime. It is a misdemeanor to have those kind of illicit gatherings, but it's worse than that. You can kill somebody you love. And I'm speaking in stark terms because that's the stark reality. And if we're going to get on top of this thing, we got to have a lot more people committed to, having fewer social interactions, and the ones they have at a greater distance, particularly outside. So we hope that they follow that advice. And the law, by the way.
Jim, would you like to ask a follow-up?
That's okay.
Now, I should note that's not the only thing we can do. We are running about a $8 million campaign to share this scientific information with Washingtonians, $3 million of which is going to local communities to design their own communication system, particularly so we can speak to people in their own native language, and so that we can have trusted messengers from the community. So we're making a very intensive effort. Former Secretary of Defense Jim Mattis is featured on one of those commercials. We're pleased that we've got increasing assistance from both parties. Leaders from both parties are now showing this is no longer a partisan issue. I was on a phone call with Vice President Pence, and Dr. Fauci and Birch a few days ago, they were very clear that we needed to mask up. So we're just over that political debate. We're now just standing up for each other. And again, I got to tell you, I am really pleased. Jim, you said it's like 90% in Spokane County. That's fantastic. You know, we want to get 95, but you know, what was it, 10 or 15 a few weeks ago? So we have really demonstrated profound willingness to help here on this masking part, and I just could not be more pleased about what people are doing. But there's a few other things we've got to add to this if we're going to save ourselves.
Next question comes from Keith Wiscoma.
Governor, why crack down on restaurants, and why not let taverns and bars provide food operating under these same restrictions?
Well, because there is a social behavior associated with alcohol that's a little bit different than carbohydrates. And we have been shown that when other places have done this, it has had an effect. Arizona, in our call with Dr. Fauci and Birch, they pointed out that Arizona has taken this approach, and they've reduced their infection rates. These things work. And we have a different approach for restaurants, which instead of necessarily limiting the total people, at least in phase 2, we just are suggesting let's just dine with our households, because that's where the real danger is when I'm sitting across somebody not in my household. That's really dangerous. That's the most dangerous 3 feet in the state right now, of dining on a great lasagna and infecting your buddy that you've known for 40 years so they get the disease you have. That's really dangerous right now. So we basically are going to say we're not going to do that for a while. We're going to dine with our son or daughter, or spouse, or our housemate. And we think this could be a very, very effective approach, at the same time allowing some restaurants to continue in a very difficult environment. Now, by the way, these are indoor restrictions. So these restrictions only apply to indoors. So restaurants will continue to be able to provide, under our previous orders, for outdoor service, unchanged from our previous orders.
Keith, would you like to ask a follow-up?
Governor, the phase pause ends next Tuesday. Are you going to extend the pause in phases?
Yes, I see no way that would be changed given the infection rate that we're experiencing.
Next question comes from Jerry with the Everett Herald.
Governor, maybe you could clarify a couple of things. First, how long will these business restrictions be in place? And you just said they only affect indoor, but bars, they're not allowed to serve outdoors, right?
Well, I believe they are under this restriction. John, can you confirm that?
Yes, that's our intent, is that they'll be able to serve outside.
Now, we hope when do that they're aware of their social distancing to the extent humanly possible, because outdoors is a lot safer, but it's not zero risk. So it is our hope that people try to retain that 6 feet, even though they're outdoors. And, we'll be watching to see if this is successful, to see if additional restrictions would be required. This order is until further notice at the moment. There's not an expiration date set at the moment.
Yeah, just a little more elaboration on also another aspect. I suspect counties in phase 3, many of which have shown few new infections and deaths, are going to feel like they're being moved back to phase 2 without a sort of a formal announcement. Is that essentially one of your intentions here too, to move the state more into sync across the board?
It's less about being in sync. It's more about the necessity of reducing the transmission rate in a meaningful way. That is our driving motivation. It really isn't changing the whole phase, because the phases apply to a whole host of different activities and environments. But for these ones that are identified, yes, there is a change, and it's a necessary one.
Next question comes from Drew with King 5.
Governor, the teachers union, the Washington Education Association, is calling for you to declare for schools to open remotely in September. Is it too early to think about that? And is labor going to be a concern if teachers don't feel safe, if a district decides to have some in-class learning?
Well, I'll just share with you what the state is doing, the Department of Health. we have established very, very strong guidelines about what schools will have to comply with to reopen. Some have suggested they're the best in the nation because they're so comprehensive and sophisticated and based on good science. So basically what the state has said is that local communities will need to meet these guidelines to assure safety to our students and our educators to reopen. That will be a requirement. And that is a state requirement. At the moment, local communities are now working through to express their democratic will about what to do about reopening. You've seen several decisions by local communities recently to go to remote learning rather than on-site learning. We are not prejudging those decisions by local communities, but we're continuing to talk and listen to people to see what their plans are and what they're suggesting. I've been talking to Superintendent Reckdale as recently day before yesterday about that. And this is going to be a work in process. And that's frustrating because we all would like to have certainty about this right now. But the infection rate and the need for communities to reach their own decisions, including listening to the advice and desires of educators who are the people right there in the classroom, that's very important for those communities to continue those discussions.
Drew, would you like to ask a follow-up?
What about a district like the North Mason district where 15% of their students, their households, don't have cell service, don't have internet access? What can the state do if they have to go online only?
Well, we know that that there are real challenges for equity, which is so important to us, and we know that there's certainly not equitable access, and so we want to help as much as we can. I have proposed using about $2 million of state funds to get access to technology for some of the students who do not have them. We're talking to legislators about that, and we hope we have a resolution of that in the next few days. We also would like to see some assistance to train educators in some of the new successful protocols for remote learning as well. That's an important component as well. So there's a couple things we can do, and we stand ready to listen to other suggestions.
Next question comes from Alexis with the News Tribune.
Governor, we heard from a movie theater owner who wanted to know about the science behind the tighter occupancy restriction on his business compared to, say, restaurants and other places. And he wondered, couldn't the state issue a more constant set of rules for places of public accommodation? Can you speak to why some of those differences are necessary?
Well, I think some of the business owners have been concerned and frustrated by this. And I think it's legitimate and sincere because it's everyone would like to have the benefit of the most flexible system of any industry. What we have tried to do is to tailor the approach to the environment and the transactional relationship of people as we understand them in these settings. Now, I'll give you an example of this. For restaurants, we are now prohibited for you to go and sit at a table with someone who is not in your household. That is more restrictive in a sense than the restrictions on theaters. You can still go with a friend to the movie theater, but it'll still have a constrained requirement of 25%. So they're different, but they're appropriate to the circumstances, we think, in a way that is the least restrictive and most successful for businesses to actually operate. But I will tell you, this has been a very challenging to try to use a laser beam and a scalpel to get exactly the exact level of restriction that is the fairest and equal for all possible industries. It is an impossible task to some degree. We have done the best job we possibly can. And to the theater owners, who I love because I love the art form, I can say that these are just necessitated by the pandemic. We simply have to reduce the number of occasions that people are within a certain distance of each other in an indoor setting. That's just a scientific requirement. And we've done the best we can to accomplish that. Restaurants for phase 3 have also been restricted. There is an additional restriction here for restaurants to go down to 50% occupancy in phase 3. So both great industries, both great small business people are going to be affected by this. It is difficult, it is hard. We've done some assistance of a $10 million fund to small businesses, but that does not ameliorate the problem. I understand it.
Alexis, would you like to ask a follow-up?
Oh, thank you.
Next question comes from Hannah with Cairo Radio. Hannah?
Yes, can you hear me, guys?
Yes.
Okay. There are several restaurants and bars that I know personally that were already really hanging on by a thread. This new restriction is likely going to knock some people out of business. Is there any new relief for them, any other relief? And then also, can you speak at all to what metric you might be looking at to reverse this? Maybe 2 weeks from now, if numbers do what, you might be able to lift these restrictions, and conversely, if in 2 weeks it's worse, what's next? What's left to restrict?
So the question, is there an additional relief fund? It is possible. It is significantly dependent on what the Congress does in the upcoming weeks on a potential relief package from the federal government. So there is some possible additional relief for small businesses associated with this, but I cannot guarantee that at the moment. We continue to look at the application of the CARES fund that we have received, and we can't sort of spend that all on day one or day even 100. So we're trying to make decisions to have that available for the losses we think we're going to have. So the best I can say at the moment, it is possible. And we certainly understand that quite a number of businesses are on the edge, and we really understand that. Your other question was about, what was your other question? You had a second question.
In 2 weeks from now, what would you want to
Yeah.
see?
Well,
Oh, sorry.
Well, we would like to see a significant reduction of what we think of as the R0, which is the infection rate. For every person who is infected, it infects a certain number of other people. We need to get that significantly down. And I can't give you a magic number for that, because we got to look at a trend too. What has been the trend? And I appreciate your question, because you asked about 2 weeks. That's kind of even the most minimal time period where you can really recognize a trend. So, it'll be a period of weeks at least before we could see any significant change in this, I believe. Now, I continued to express hopes that the masking initiative that we put fully in place on, I believe, July 7th, will have an impact, within a month and a half or so. We hope that's going to be the case in combination with these things. But because we face an outcome like Florida's, we just can't wait, because once the pandemic gets to a certain level, it's out of control and it's just too late. You can't reel it back in. So that's why we had to take these steps now. But as I said, we're hopeful they're going to have results in the weeks and months to come.
Hannah, would you like to ask a follow-up?
Clarification question for Secretary Wiesman on the masks. Is there any place at all now that you wouldn't be required to wear a mask?
So inside your own home with your household, you're not required to wear a mask. I'll say unless, of course, you have tested positive for COVID, then we really want people to isolate themselves in their home and, again, take these precautions. So really, it's pretty much any time you're outside of your house where you are likely to come in contact with some folks that we really want people masking up. The science is showing that that's the thing we need to do. Again, we're really encouraged by what we're seeing in communities that are masking up. We know that it works, and we know Washingtonians want to do what works. So that's what we're looking forward to.
If I can just add one thing to John's very clear description of the rule. Look, if you've just climbed Mount Rainier on a solo climb, and there's not another climber within a quarter mile of you, you may not need a mask. We understand that. But we have to understand, anytime you're within a people that comes within that 6 feet under any circumstances, we really need you to wear a mask. That's just an imperative. The risk is too great in all circumstances not to do that. So we're looking forward to people helping us out.
Next question comes from Pablo with Univision. Due to some issues, I'm going to read it out. From the records where ethnicity was available, 44% of reported cases of COVID-19 in the state are in Hispanic people. What is being done to support this population?
Well, first off, we have adopted quite rigorous safeguards for hygiene where many of the folks in this community work, particularly in agricultural settings and in production settings. And that is a whole suite of hygiene requirements to reduce the risk, not eliminate, unfortunately, but to reduce the risk. And those hygiene requirements are cleaning, cohorting, so you're not exposed to so many people, transportation, residential requirements. Our rules in that regard were recently upheld by a judge just a few days ago, and they're quite comprehensive. I wish I could say they totally eliminate the prospect of this, and that, which is very difficult because these folks work in industries where they frequently are much closer than in many, and they can't telecommute. This is a community that doesn't have the luxury of being able to telecommute in the industries they work in. So first off, we've adopted, I think, some comprehensive hygiene requirements. Second, we will be standing up. I hope to announce this fairly shortly. We're in talks with legislators on this now of a fund to help the people who do not get access to assistance now because they lack documents. These are people who are feeding us. These are people who have been denied immigration status by the total failure of Congress to pass comprehensive immigration reform. There are people who've been here for decades. So that's a package that we want to help these folks. We also have some of the things we've announced here, and the housing thing could help because we want people to be able to isolate when they get symptoms and they're either positive or waiting for a test. We want them to be able to isolate. So that's why we're creating a fund that can be helpful in that regard, so that they won't transmit the disease to other coworkers or community members. We're also running the communication system that will be in Spanish and other languages pretty intensely to make sure that these folks do have information. And by the way, I'm curious about your number. The number I have seen is a little lower than that, but it doesn't matter. It's still very disproportionate to the number of folks that are helping us. And by the way, when I mention the agricultural industry, look, we know that this is not the only industry Latinx people work in. It's just one that there's a particular concentration. That's why I mention it. But all folks of this community deserve protection. And I would point out that the things that we're doing today also protect that community. It protects all communities. And it needs to, because every ethnicity is subject to this disease. And we're going to continue to look for ideas.
Would like to add to that answer.
Yeah, go ahead, John.
In addition to all of those things that you mentioned, Governor, we've also translated key documents, education documents across the state, across agencies into over 30 languages. We have also given out community-based contracts to 41 different community-based organizations to help with outreach, to help with communication to the Latinx as well as the Native Hawaiian and other Pacific Islander communities that we know are also hard hit by this. And we have been developing a care coordination and support system starting in Yakima, in one of the hardest hit communities, with locals trying to help people get the resources they need. So that, in addition to the campaigns that you mentioned, Governor, and supporting some of those campaigns in local communities that have also already been happening around masking and other issues related to COVID, trying to get information out. Lots to do, of course.
Next question comes from Carolyn with the South Seattle Emerald.
Hi, Hi, yes, this question is for both the governor and Secretary Wiesman. Based on some information the Emerald received, it appears as though South King County might be one of the new coronavirus hotspots. What's being done to tamp down on that spread and allow for greater access to both healthcare and testing, given the number of low-income families, immigrants, and people of color who live there, all of whom, as we know, suffer disproportionately from the virus?
John, do you want to address that?
I must say I did not hear the question fully. There was a fair amount of breaking up on my end. I heard King County testing. So I don't know if we can maybe repeat the question.
Yeah, sure. Can you hear me all right now?
It's a bit better, yes.
Okay. So it appears as, based on some info the Emerald received, it appears as though South King County might be one of the new coronavirus hotspots. And so I'm asking what's being done to tamp down on this spread and allow for greater access to both healthcare and testing, given the number of low-income families, immigrants, and people of color who live there, all of whom suffer disproportionately from the virus.
So indeed, in King County, certainly one of those hotter spots is South King County. And I know that the local health department has been working with a coalition of folks to do outreach to the community, make sure that they are getting the education and, communication resources and language in places they can understand. I don't know for sure which testing sites might have been stood up in the county there, though I will say King County has stood up a number of community-based test sites for folks and have really stepped up to that challenge. So working in these local communities is really primarily a local public health responsibility, and I know that King County's been one of those that's been greatly involved in inviting community into the planning and into the delivery of services. The dollars I know that we've given out to community-based organizations that I mentioned earlier certainly help support that work in those sort of hotspot communities. King County can probably also give more detailed, specific information for that part of the county.
I met with the South County leaders in business and health providers and others, and you're right, it is a hot spot in South King County, and folks have lower income levels, and that's the folks who are working some of these jobs that have to be in contact with the public. And so we have been looking on how to help. That's why I'm glad they have some drive-up testing there. And as far as testing, I want to note this. We have increasing challenges because we've doubled the number of tests we've done in Washington State in the last month or month and a half. But we now have a threat of not having enough reagents. This is the chemicals you use to run the tests. And we've been told that some of the providers of reagents are going to reduce their shipments, or at least there's a possibility that some of our public labs, we're very concerned about that. And it's again a reason why we need the federal government and the president to use the Defense Production Act to require the manufacture of reagents so we can get people tested. And that's a simple, it requires a manufacturing increase so we've got enough product to actually do these tests. Another thing I want to note is that we have thousands of people who have insurance today in the South King County area that some folks back in Washington, D.C. want to take away, which is unbelievable to me. In the middle of a pandemic, there's an effort to take away their health insurance, which is unbelievably cruel and callous in my view. And that's the healthcare reform we passed several years ago that has worked very, very well. So one of the things we're doing for this group of folks is to stop Donald Trump from taking away their health insurance. And I hope we succeed because there's thousands of people who need this, not only to pay for testing, but when they become hospitalized. And you know how much that costs. So I hope we succeed in this battle. I believe we will.
Carolyn, would you like to ask a follow-up?
Yes. So from what I understand from at least one senior center director, there are still some questions about where senior centers fall in the phased reopening plan. And obviously, this is now in light of the new restrictions in phases 2 and 3. So just to clear that up, do they come under phase 3 or phase 4? And along those lines, what programs and relief efforts is the state working on that are specifically targeted towards homebound seniors without adequate access to food?
Well, everything we do includes seniors, and I'm glad that's the case. The question about the phases depends on which county you're in rather than which entity is involved. Do you know which center raised this issue with you, if I may ask? Because we'd like to get them a clarification if they have any questions.
Yeah, of course. It's the Southeast Seattle Senior Center. I know they have some questions, and particularly because they have an increasing number of homebound seniors who are afraid to go outside because fewer and fewer people are wearing masks and they don't want to get sick.
Well, we'll contact them. Thank you for that tip, and we'll try to clarify anything they need clarification of. We will definitely do that. By the way, I just want to, you've brought up another reason to mask up. Look, when we mask up, it allows people of a certain age to feel free to go out and take a walk, and that's kind of not too much to ask for ourselves, to allow senior citizens to be able to go out for a walk and feel safe. That's what we do when we wear a mask. So again, thanks to everybody who's doing that. Now, we also need seniors to wear masks too. It goes both ways.
Time for a few more questions. Next question comes from Ashley with the Chinook Observer.
Hi, Governor. Today it was announced our city mayor had contracted COVID-19. Are you aware of any other Washington mayors that have contracted the disease? And what are your thoughts on the increased case counts in towns like ours, tourism towns, Ocean Shores, Long Beach, which are seeing spiking cases and as more traffic comes from Portland and Seattle?
Well, I'm sorry to hear about your mayor. Hope he or she's going to be okay. I have not heard of others who are positive, and we encourage everybody to protect themselves, obviously. The tourism-related infections are challenging for us because we get pulled in different directions. I'll give you an example. I was talking to our director of ferries today, and I was asking her how people are responding. We've had to have reduced service because we have so many people who either are positive or, seniors or compromised. So we've had staffing challenges. And what she told me is a big problem is that half the constituency want them to increase service to like the San Juan Islands or Whidbey Island, and half of them want to decrease service because of the phenomena you're talking about. And it's the same thing with communities. We had one community from Eastern Washington the other day tell me, saying, please tell all the tourists to stay home. But I turned on my television the other day, and there was one county with an advertising saying, please come visit my county. It's great fishing and hiking, and I'm sure it is. So this is a real challenge for us. We try to respond to the local community's desires to the extent they have been expressed. So when we hear of a community that does want to try to decrease tourism, we'll try to respond to that. We'll try to spread that information. What I would say is that anything that involves unnecessary travel, you should think twice about. You should be very cautious about any travel when you're inside, anywhere. So if you're going to go to, Leavenworth and you're going to be inside, you're just increasing a risk of transmission of this disease. Now, maybe if you want to go and hike the Alpine Lakes Wilderness when nobody's around, that's a different issue. But any travel that involves any time being inside with people who are not in your household, if you can put that off a little bit, that sure would be great for everybody, and I hope folks do that.
Ashley, would you like to ask a follow-up?
So the ban that you talked about, or the closing of games and bars, does that extend to businesses that don't have to do with food or bar alcohol, such as like putt-putt golf or arcade businesses? And when does that ban begin for businesses? And maybe you said this and I missed it, so I apologize.
Yeah, it does, it applies to what you might think of as sort of arcade situations that are indoors. It does not apply to outdoors facilities. So if you've got an indoor batting cage, it applies to you. If you've got an outdoor batting cage, it does not. And I can't remember the effective date. John, can you help me when that part
It's a
goes?
week from, yep, it's a week from now, July 30th.
Next question comes from Kate Walters with KUOW.
Hi, Governor. Just wondering, what is the threshold for you to fully roll back into a stay-home order and not just tweak the restrictions in various areas is happening now?
Well, I wish I could give you one specific metric or number about that. I can't, because this is something we look at a whole host of different metrics in combination to make a judgment almost on a daily basis of where we are and what is going to be necessary. What I can say is that we made a decision in March, and under those conditions, we needed to have fairly significant shutdown of our economy, and that was very painful. If we ended up with those conditions again, and that was the only course open to us, it's a possibility we'd have to go through that again, but I do not want to have to go through that again. That's why we're taking more relatively modest, I know this doesn't sound modest to a restaurant, but it relatively modest as the whole, in regards to the whole economy. So we're taking some relatively modest steps here today in the hopes to avoid big shutdowns in the upcoming weeks and months. And we think it is a very responsible and only scientifically credible thing we can do right now.
Kate, would you like to ask a follow-up? Okay. Next question comes from Paul with Bloomberg.
Governor, do you believe it's possible to successfully resurrect the state's economy, first controlling the growth of the pandemic? And if you could please give the reasons behind whatever answer is, I'd appreciate it. Thank you, sir.
Well, I guess in order to return what you might think of our pre-COVID way of traveling, way of recreating, way of dining, in order to safely return to that pre-COVID situation, we'd have to have largely pre-COVID transmission rates, or a vaccine that would, or a curative situation which would make this a much less fatal or devastating disease. So in some sense, you need to restore those conditions. Now, we are hopeful for a vaccine. We are hopeful for a curative treatment as well. And I wish I could tell you when or if those are going to arrive. I do think there's Herculean efforts going on in that direction. There are some promising results in very early trials, as we've heard about. That's good news. But we know that with the billions of people on the planet, there's also a manufacturing issue to deal with. So I'm digressing for your question, but I will just tell you that the one thing I know today is we have to get down the infection rate of this pandemic if we are going to have any hope of restoring the kind of economy that we need. That is abundantly clear to me. There is no scientific doubt. There is no nuanced ambiguity. It is just a reality. And that's why we're acting today. And we're acting in a way that gives us hope that we can avoid more difficult decisions later on.
Paul, would you like to ask a follow-up?
Well, thank you.
Final question comes from David with Crosscut.
Yeah, Governor, considering some of the fairly staggering numbers we've seen around renters and their confidence in their ability to pay rent, is $100 million enough? Is there consideration for finding more money or doing more to prevent possible future evictions when the moratorium does eventually end?
I don't know if enough means that no one ever will have, economic challenges. Probably not. So is there, I guess maybe if I can change your question a little bit, is there a possibility of more at a later date? Yes. Again, it's dependent largely on what Congress does in the next several weeks to allow us to have additional, revenues available in the state of Washington. I think that will largely tell the tale.
David, would you like to ask a follow-up?
Sure. Some legislators, would like to hash this out before January next session? Is there, where's consideration at right now on a special session?
Well, there is not any consensus at all about that in the legislature, in part because we don't know our fiscal situation yet until the Congress makes a decision. That's potentially a $2 billion question mark. We don't have the answer to that. And we do have the fortunate situation that we can get to January because we have this, $3 billion reserve account. So that will allow us to get to January when the legislature is regularly scheduled to come back without humongous changes. Now, I have made about $600 million in reductions in otherwise planned expenditure, and that in combination with the reserve will allow us to get to January where we will have much more clarity because we will know whether Congress act or not. We will also have more clarity of the condition of this pandemic. So I think that's the direction we're headed at the moment. No, I just stand before you as a governor who has seen Washingtonians step up to the plate big time in the last few weeks wearing masks. I'm governor of a state that has demonstrated that we can bend this curve because we've done it once, and we know we can bend it again. And I'm governor of a state that believes in science. And those three things ought to serve us well in the upcoming weeks. And I want to thank everybody for their strength and their perseverance and their realization we are going to get through this because we're in it together. With that, please wash your hands and mask up. Thank you.